so just to give us plenty of time, both for what you're going to say and for what we want to hear from all of you, let's keep a more full introduction. I think David did a good job just giving a short introduction. And just go straight to what you are doing now. And you have written so powerfully about your own journey, having been diagnosed with multiple sclerosis 20 years ago. And you've actually turned that personal diagnosis into an incredible battle to help others. And I'm just thrilled that together we've launched a dedicated section on Thrive called Brain Health, which not only is there to address people with chronic conditions, but also to help everybody else understand that in a way, the same things that are important for you on a daily basis are important for everyone.
That's right.
So tell us some of the alternative things that you are doing that have helped you tremendously in dealing with the disease.
Well, thank you, and thank you all for being here. Ariana is extraordinary, and I am now helping her with her Thrive blog that she is running on health, and especially this section on brain health. I was diagnosed in 1998 with multiple sclerosis, and I was desperately ill. I was living in Boston, and for the first 4 months of my diagnosis, my one doctor basically just diagnosed me, sent me home, and said, good luck, and no treatment, nothing. And I just kept getting worse. And then I was so lucky to have been introduced to Dr. Howard Weiner at the Brigham and Women's Hospital, who is now the co-director of the Ann Romney Center for Neurologic Disease. And he started treating me aggressively with infusions of steroids and also a little bit of chemotherapy and steroids. I don't know if any of you read the news yesterday that they're making breakthroughs on this treatment with MS. And so my journey started with me being desperately ill, desperately afraid, and it was sort of before you could get on the internet and search and figure out what was going on. And so I went through a phase where I was very depressed. I was very lonely. I thought my life was over. I thought I'd never have another good day. And so from my perspective now, having been in that place, I have a huge understanding and sympathy for those that are newly diagnosed with a neurologic disease, and have a huge amount of compassion for them. And from that has grown my willingness and desire to give back, and the formation of something called the Ann Romney Center for Neurologic Disease, which is at the Brigham and Women's Hospital in Boston, where we study multiple sclerosis, Alzheimer's, ALS, Parkinson's, and brain tumors. And we have 250 researchers that we're in one building now. We have a nice brand new building. And we have clinical space where they're meeting with doctors. We have research, and we have all sorts of wonderful new techniques and methods of understanding what's in the brain. And Dr. Tanzi, who's sitting next to me, is obviously aware too of how important it is to have those diagnostic tools. We have the 7 Tesla MRI imaging, which, we don't have a lot of time to go into that, but it basically is given us an opportunity to look into the brain, and I like to say to find that monkey that we never saw before that was in there, to see on such a much deeper level, to try to have a better understanding of what's going on in the brain.
And yet what is amazing is that even though you're dealing with this most advanced technology, you're also using some very old-fashioned things like riding horses. Tell us about that help you on a personal level.
Well, I had to go on my own personal journey to find, the medicine helped stop the progression of the disease, but it did not make me feel better. I was still completely exhausted and not living a very rich life, I would say, very difficult. And I thought I had to start finding my own way. And I started doing alternative therapies. I started doing acupuncture. reflexology, different things that helped me, that gave me little moments of energy. But the biggest thing that made the biggest difference in my life, and it's so strange, is riding horses. And they are the love of my life. Mitt jokes that, you know, they are my true love. I am in competition right now. My horses are in Wellington, Florida. I will compete. I competed last weekend. I'll be competing in 2 weeks again. 2 years ago, I was the highest ranked amateur rider in the country. And that was literally from 0. I went from 0 to 60 with horses. But
You started after the diagnosis?
I started after the diagnosis. And so, but they're healing creatures. There's no mystery that they're used for a lot of different therapies. They're used for post-traumatic stress syndrome. They're used for anyone that needs a little help physically, where maybe they have some spasticity. It's extraordinary to see someone be put on the back of a horse and see a child that really is just in a ball, and then to see them sit up straighter by just being on the energy, with the energy of the horse. And it's amazing. You see people with speech problems that can't talk, and you put them on the back of a horse, and it opens up something in the brain. So there's things going on out there, by the way, that seem very mysterious, but are also very, very helpful. And so there is like the whole person that we have to address. And Ariana knows, I mean, so well. I mean, she and I are on this mission to educate people about all the other things that we've got to do to stay healthy. And sleep is so important. Sugar, Ariana, bad.
A little bit?
And not even a little. I mean, honestly, I have cut out sugar. I don't know if you have completely. No sugar. I am no sugar. I will take, it's not like Mitt had his birthday. I had 1 bite of birthday cake.
And when he wins the Senate seat, you'll have another, right?
You know what? It is 1 bite leads to another bite. This is true. But sleep and sugar causes inflammation. Inflammation causes all sorts of problems in the brain. Having a healthy gut. We now know that the gut is the second brain. Here I'm sitting next to the brain expert, but I'm going to tell you all about it.
Rock on.
And so, you know, there's so many things that we have to do to keep our gut healthy, to sleep, to cut down on our sugar, to exercise. Oh, these articles, these studies that are coming out all the time now, exercise is so important. And so, you know, having been in a really bad place where I thought I was 90 years old, never going to have another good day, to being who I am today. It's my 69th birthday in a few weeks. I am doing really, really well, but I am doing all of the things that Ariana and I are now talking about in Thrive. And it's just so important that we bring all of those things into our lives, incorporate those things so that we can stay healthy, because we are going to live longer. And we all want to have healthy brain health. And none of us want to have to go visit Dr. Tanzi. And
Although what is amazing about Rudy's work is that from the scientific point of view, it completely validates what you have been saying. And Rudy, in your latest book that you wrote with Deepak Chopra, The Healing Self, you talk about the need to redefine the entire way we think about chronic illness, which sounds very much like what Ann was talking about from her own experience. And you called that incremental medicine also. So tell us about what is this redefinition and what is incremental medicine? Well,
you know, we heard this morning about the fact that the word heal comes from the word whole. Whole gives rise to the word holy, to the word heal. And it's about connectivity between brain, body, mind, spirit, and yourself, and connection with your world. It's what we've learned in Alzheimer's disease, and you've really nailed every single one of them, and is that neuroinflammation is the enemy. And even in the body, whether it's heart disease or diabetes, inflammation is what takes you out. And it's part of the body's immune system that when you have a damaged organ or tissue, the body tries to remove that particular tissue because it's injured. And in the brain, when this happens in a part of your neural network, so you have 100 billion neurons and tens, if not hundreds of trillions of synapses, when you have damage in a certain part of the brain, inflammation or neuroinflammation kicks in to kind of quell that part of the grid because it's now a liability. And what we've learned in Alzheimer's, back when I was a student at Harvard, and Dennis Selko and I've worked together for decades.
Dennis is my co-director of my center.
Right, and we do tons of projects together. And the first genes that we found, back when I was a student at Harvard, I found the amyloid gene. I named it amyloid precursor protein, or APP. It's still our main target for Alzheimer's. So many of us in industry targeted amyloid, the beta amyloid plaques. And there's been tons of controversy and debate about that, because when you put those genes in mice, they make plaques, but they don't get the rest of the disease. And we figured out something really fascinating a few years ago. It's because they're mice. They're not human. And when we were able to build mini human brain organoids from stem cells, we call it Alzheimer's in a dish. So we can recapitulate plaques, the tangles, and the inflammation in 6 weeks in a dish in a mini brain organoid. Then you see what's really going on, that the plaques cause these things called tangles, which kill the nerve cells. And it turns out, if you look at brains of resilient people, you can live with tons of plaques and tangles without Alzheimer's. The brain has to react to those plaques and tangles and little pockets of nerve cell death with inflammation, where the brain's primitive immune system is saying, wow, we got a damaged part of the grid, take it out with inflammation. That's when you lose 10 to 100 times more cells. And that's why what you're saying is so important, that the battleground is neuroinflammation. I like to say the plaques light the match, the tangles are like the brush fires that spread. You can live with them. But when neuroinflammation comes in, you have the forest fire. And many of the trials that failed in Alzheimer's targeting amyloid, because that's the first thing we learned about from the first genes, they failed because we were trying to put out the forest fire by blowing out the match. And now we know that you have to treat those plaques 10 years before symptoms. And the big news, as of last month, that this is thrilling, and I think that this is a turning point in history for Alzheimer's, is the FDA came around. And last month, the FDA announced new guidelines that they'll let us do trials that attack the pathology that leads to dementia before dementia in people who might have plaques but no dementia or no cognitive problems, and they will consider drugs that move the pathology without having to necessarily improve the cognition in people who just have pathology.
But also beyond drugs, there is now, from what you have written, clear evidence that doing things differently in our daily lives will have a huge impact. Tell us, for example, the impact of sleep.
Right. And you hit a lot of them. I like to use the acronym SHIELD. Shield your brain. S is for sleep. 8 hours, not 5 or 6 or 7. 8 hours. And even if you can't get it done continuously, take naps. H is handle stress. We published a paper showing that meditation actually extends telomeres and drops inflammatory gene expression. The I stands for interact, stay social. Loneliness is a risk factor. Not living alone, but if you're stressed out about being alone, loneliness is a stress factor. E is exercise. Exercise removes inflammation, it removes plaques, and it also causes new nerve cells to be born in the hippocampus, which is the battle zone for Alzheimer's. That's called neurogenesis. L is what you're doing now, learning new things, because the more synapses you make, the more you can lose before you lose it, basically. And so we tell people, when you're going to retire, don't just think about financial reserve, think about synaptic reserve, build up those synapses so you can lose a few before you get into problems. And finally, diet. Mediterranean diet, #1 for brain health. Take care of your gut microbiome. We've published papers just this past year that your gut microbiome can actually control the amount of plaques in your brain. And studies from MS have shown that gut microbiome has a profound effect on neuroinflammation in the brain. So, these are things you can just decide to do right now. These are choices you make that will determine where you are in the future.
And ironically, the more stressful your life and the more hectic your life, the more necessary these interventions are. Mm-hmm. In fact, Anne remembers, during the time when your husband was running for president, we had created a Thrive Oasis, very near the convention center, where we had massages and healthy food and meditation, so that very rushed and exhausted politicians and journalists could come and take little breaks. And we had a fantastic massage therapist whom I sent to Ann and me to prepare them for the convention speech on the night of his acceptance. And it seems like basic, but more and more people now are recognizing how important it is and scientifically validated. So let's open it up now to everybody who has questions, comments. Who wants to go first? Yes.
Thank you, Ann, for sharing your perspective and focusing on advancing brain health. My question is on patient experience at the Ann Romney Center, because there's always two health systems. One is for those of us who know people in healthcare and know how to navigate it. And the other one is for the average person who gets hit with a life-changing diagnosis. So I'm wondering if you've thought about any innovation in patient experience at the Ann Romney Center.
We have, and you know, the other wonderful thing is I refer people all the time, and it isn't like you have to know me to be able to be a patient at that center. There's been a great deal of thought given to making sure that that experience as a patient, having gone through the trauma that I've gone through, that it is a much more pleasant experience. And everything happens in that same building. The MRI imaging is in the basement. The doctor appointment is in the same building. By the way, the researchers are in the same building, and we have them interact with patients, which is an interesting concept because when they see the actual person that is dealing with the disease they're trying to understand and help cure, they go back up to the lab and are so excited and energized and you know, just want to work even harder. So we have like this whole integrative system that we have at the Ann Romney Center. And so anyone can call and make an appointment. It's open for everyone.
That's wonderful.
Yes.
Hi, Kevin Rosofsky, Quanterix Corporation. I was interested about the imaging technologies that you mentioned, and the whole area of biomarkers is becoming such a big area of focus. And there's a lot of new publications that are really showing that you can see brain health in blood. I was curious if you could comment on the future role that you think that these biomarkers might be able to play as you are doing your exploration of all the environmental factors and triggers like exercise and diet and sleep and the linkages we might be able to do scientifically to maybe advance this quicker.
Well, you know, for Alzheimer's disease, it's going to be all about biomarkers, and really, we can almost use biomarkers interchangeably with the pathology that occurs 10 years before symptoms. You know, Alzheimer's is unique, and as is many neurodegenerative diseases, that we don't diagnose them until you have symptoms, which is really absurd when you think about it. You wait for the brain to degenerate to the point that you have cognitive impairment, and you say, okay, now we're going to fix it. We don't do that with heart disease. I mean, God forbid we did that with cancer. We don't do that with diabetes, but we do it with Alzheimer's. And that's going to change. And the FDA has now made that possible with their new guidelines last month, where we can look for brain imaging, seeing plaques in people with no cognitive problems, or tangles, or doing a blood test for different pathologies of Alzheimer's 10 years before symptoms. And that's when you start treating. I mean, imagine if you had a heart attack and congestive heart failure, and now you say, I can go to the doctor, and now he can prescribe me Lipitor. We had to do that 10 years before. Alzheimer's is finally catching up. And biomarkers and early pathology and treating before symptoms and never getting to the point of symptoms is how we're going to beat this disease. And I think we'll do it over the next 5 to 10 years, now that we have the FDA on our side saying, we'll let you do those trials to hit that pathology early and look at possible approval. Then post-approval, let's see if it works and stop the disease from going to dementia. Big news there.
Thank you so much, Rudy. Thank you, Ann. This is important not just for people with chronic diseases, but with everybody, because everything you mentioned, including everything that goes into the shield, is what everybody needs, except that if you have a chronic disease, you absolutely need to do these things. The path is more straight and narrow. So thank you so much for educating us all. Thank you.
Thank
you.